Welcome to the tomorrow of healthcare in the Oracle Cloud. A place where disruption is your reality, and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Pela família, pelos amigos, pelas férias, pelo futuro, pela sua saúde. Não adie mais o que ficou esquecido. Em 2020, quase 5 milhões de exames clínicos não Covid ficaram por fazer. Pela sua saúde, não adie mais os exames que o ajudam a cuidar de si. Unilabs, há uma química que nos une.
Sometimes it's hard to come home and act as if you didn't just witness something life-changing. Because you did. You were part of a critical moment in someone's life. And it makes me wonder, why is this my choice? Why am I a nurse? I know I can't change the whole world, but I can change it for one person, even if it's only for an hour or two. By being there when it counts. Nursing is a process. Assess the patient, implement care plans, get the right people together. Heart rate 115, temperature 38.5, saturation 88. Could it be a surgical site infection?
Get infection parameters. I'll be there in 5.
And technology enables just that. Connect with the colleagues, access and share information, prevent documentation errors, stay by my patient's side. It means I can do a little bit more for my patients.
Hi, Michael. You have problems with your leg. Send him to ICU.
And I get to change their world.
Hang on, guys.
And I just know.
Thank you.
This is what I'm meant to do. That's why I'm a nurse.
It's really great that we are here in the final plenary for sharing the peer conference outcomes. With me here live is Laurie Ringaert. Laurie, thank you so much for being here and holding the space for us. Tremendous job. Laurie is an expert facilitator from the IF, a dear colleague and also consultant and Chase Weavers. And Laurie, you can also start by introducing a little bit of yourself.
Oh, thank you, Paula. Yeah, I'm.
You think you're out of audio?
Oh, can you hear me now? No.
Okay, now.
Yeah. Okay. Yeah. Thank you so much, Paula. It's my honor and pleasure to be here with everyone today. I'm from Canada. So up very early, but a good thing I'm an early bird anyway. I usually get up pretty early anyway. But yeah, I'm actually an evaluator as well as a facilitator. So I always bring my multiple hats, and I do a lot of strategic planning and things like that. But I guess one of my tidbit about me is that I actually live on a boat all summer in British Columbia. So I'll just throw that out there, Paolo. And Paolo and I are working on another great conference in Winnipeg, Manitoba on looking at HIV. So that's pretty exciting.
Exactly. We are collaboration architects in that sense. Thank you much, Laurie. So what were your impressions from these overall 90 minutes in-depth discussions? What is the main, if you wanted to summarize it in a sentence?
Are you asking me, Paolo?
Yes, you, because you're holding space.
Okay, sure. For me, some of the big takeaways of these sessions was thinking about we still have a ways to go in terms of the interconnection of all of these systems. One of the things that we're still really thinking about, there's a lot of good technology there as well, but how do we get both the patients, the consumers, and as well as the healthcare providers to embrace them? And thinking about the whole idea of change management, and how do we also think about our this whole the whole infrastructure. There's a number of layers. There's the infrastructure itself, and how do we change that and make that connect? We have to bring in legislation to make sure that this all happens. And then we also have to think about who are the people that are perhaps left out, that there's people that are going to, for instance, people that are wearing some of the devices as we think about this, but there's also people that are left out, and how do we deal with that? So there's a lot of interesting things that are rising as we're going, I guess, going into the future, but also we're here now, and how do we embrace all these interesting complexity challenges?
Amazing, Laurie. Thank you so much for summarizing so well the discussions. I know that I have here session leaders on these last 30 minutes sharing. I'm particularly curious to hear about Stephen Buschik. Stephen, if you can share also in 30 seconds your impressions for the overall sharing, and then after I think Sylvia, and then we'll go on reverse alphabetical order.
Yeah, so as I mentioned before, the focus really and truly needs to be on people. Whatever we do, whatever we implement, and in our case, it seems that here we're experts on health data and digital health. To summarize it, we have an opportunity here ahead of us to really revitalize the way we implement. And COVID has learned us a lot, has taught us a lot about all of this. So here we have a big opportunity to reinvent the way we do healthcare in such a fantastic time. So this is a time to reinvent ourselves and move forward. Thank you.
Thank you, Stephen. Sylvia, and then Lionel next. Sylvia, we are out of audio.
Can you hear me?
Now, yes.
Okay, great. So really echoing what Stefan just said, it's really about the data and how we are making sure that technologies really adhere to the actual need, whether it's of the patient or of the clinicians. We know that healthcare is data rich, but it has to become a bit more data driven and I would say user-centric in a way when we use the technology. So no matter if we are talking about telemedicine, if we're talking about remote patient monitoring, IoT, or clinical decision support, it's really about trying to understand what we want to achieve and make sure that technology and the data is organized in order to serve the individuals, the patients, and the clinical professional as well.
Fantastic, Silvia. Thank you so much for that. And also I see in the room of the breakout rooms here already Carlos Jaime. I'm sure that there was a lively share of information there, and also with some participants attended. Carlos. Your main takeaway.
You asked me, I think we are all aligned. This is what is really interesting. I think we have the same experience on the same.
I think Carlos is having a technical on the room. Okay.
Yeah. Yes. Do you hear me?
We can hear you now. Yes.
Yeah. Sorry. What I say is I think we are all aligned. We have the same analysis of the market expectation. I think we have several things to do. We should invest at the European level in the real infrastructure to manage all the data and to create interoperability between all the countries and all the solutions. I think my concern is more linked to be focused. We should be focused. We are all connected. But we should be focused on real life. And we now, after the COVID-19 crisis, we know we should help and support the medical team to have a better solution to manage the patient relationship on the way to do the best decision with all the data coming.
Center, we are somewhere.
Lionel? Yeah. If not Lionel's online, then I think we go João Bocas. João? In the table, please. Yes. While John is preparing to sit in the table, we have Miguel Coelho here. Miguel, your summary? Press. Talk.
Hello? Oh, okay. Well, now it is definitely working. Yeah, so in our session, I think we, let's say the conclusions that we could take out of the session is that, AI is definitely going through a hype moment where it's being almost presented as a panacea for every single issue that is out there, and sounds like a promise to solve many issues or offer too many improvements. And yeah, as we come perhaps back from that peak of inflated expectations, and we finally land in a more real basis for the usage of these technologies, of these new technologies, the recommendation, let's say, or what we've discussed is that ideally is not to assume that we're going to have let's say a general AI that is going to address every single issue, but rather start with smaller steps. Start with very concrete universes of problems that we can tackle one at a time, and then learn from those models to become more and more general, and hopefully fulfill indeed some of the promise that these new technologies offer, without overlooking also, without throwing away also other technologies that have proven to be useful. And again, of course, we discussed the importance of data, right? The importance of gathering the data, of gathering good quality data, of gathering data that can actually allow us to come to concrete and sound conclusions. And that is, of course, a topic of interoperability, a topic of how to achieve that so that we can have proper AI.
Fantastic. And since Lionel Richard is not online, maybe Steve Costalat can prepare to address a summary, Steve, and then João Bocas in the meantime. João, over to you. I think you have a mic there.
Not sure if this, this one is working. Yeah, fantastic. Well, it was an interesting discussion with wearables, and also we're talking about data, and we end up merging to other group. But let me try to bring some remarks from our colleagues. Duarte from Unilabs mentioned that there is not one answer and one solution, and the answer would be to bring the convergence of different aspects of technology together. So, for example, the combination with wearables, with artificial intelligence, with other technologies, and that is going to push this agenda forward. On the other hand, Professor Ricardo from the Faculty of Medicine in here from Porto also mentioned that we have the technology, but we also need to work on the change of behavior. For example, if we're talking about population health, and also redesign the healthcare system of the future, we have very good intentions, but we cannot change everything at the same time. So, for example, if we work on the prevention and everybody is really well and healthy, what is going to happen with the private hospitals and things like that? But what I also notice is that these conversations are actually very timely. We can learn from the pandemic, we can learn from the technology is actually maturing, but now we need to bring the other elements together, such as the digital education around the medical field. There are other issues to consider. For example, doctors and clinicians, they don't have time to deal with data. They don't have time even to get educated around systems, around wearables. So there are actually very fragmented issues to bring all this together, but there are many aspects to consider. But personally, let me leave you with my vision. I truly believe that wearables are an essential element of the healthcare delivery of the future, and also I truly believe that wearables can solve many of these paradigms in terms of prevention, diagnosis, ongoing monitoring, and also educate people about their own health. So I believe the wearables are really the way forward in the future.
Fantastic. And Steve, can you connect something with wearables? And then I ask Carlos and Steve to come back to the plenary, please, because it's here that we should be finished.
Yeah. I didn't hear properly the question, Paolo. Can you repeat?
João Bocas said that the wearables is the future. Can you connect with your experience? Are you resonating with this?
Oh, yes, that's just a kind of obvious. We are seeing more and more the need in hospitals in real life to have data, real-time data on a daily basis, on whatever the patient is doing or at any time of the day. So it's definitely having those wearables with the patient life, with the patient hospitalizations all time long. It's something really needed by the hospitals and the physician right now.
Mm-hmm.
Those kind of data, they are the ones that are missing today in the medical practice. In the medical practice today, you are just doing acquisitions when you have a patient and a doctor, and the doctor is only judging or diagnosticing the needs on a very specific time. More and more, where medicine is trying to progress is really to have data when they are not with the physicians. And wearables are the solutions. You cannot have people monitored by big equipment all the time, but wearables on a watch, wearables embedded into some clothes are definitely the future for a new field of data that we have never been able to exploit before.
Thank you so much. I kindly ask Carlos, Jaime, if you can come here to the plenary because we have to close from here, and also Duarte, if you're here with us, please, Duarte.
We will come now. Is that joining?
Yes, please come to the plenary now, and we close the room there. Thank you so much, Zoom team. Technical Zoom team did an incredible work today, having these 4 breakouts all together. Laurie and Uska, you want to share anything else in this moment while we're waiting? And Bart Reich, not in the room.
No, I think there's been some really great comments shared now, Paulo. I don't have anything to really add at this moment. I think there's been some really incredible conversations, and I think there's a lot of good thoughts as we move forward into the future with technology.
Fantastic. I think it was a well-spent time. I have to tell you that when we started this peer conference, it started really the challenge. I think we had to face the imprevisibility of hybrid gatherings like these ones, and trying to synchronize the dialogues in the rooms and then in the Zoom. And it was an experience that was stressful at the beginning, but then in the end, I think that a lot of content was shared, and I was at the times I was here like a spectator and listening, and what was said. I'm so glad that you have all this recorded, because we need to move forward this agenda, and the importance of health data for the next generation healthcare systems is something that is going to be really transformational if well applied. And we are lucky to have here renowned experts. I think in this summit we had the persons, the stakeholders, the industry leaders that are on top of the edge on health data. So if you need to ask something, you need to have doubts on your organization, you have any concerns, please, now is the moment to talk to them. We are going to have here, Laurie, unfortunately you're not coming here. We cannot offer you the lunch. We're going to have also, after the closing keynotes that are going to start in a few minutes. Here, the closing keynotes will be in Portuguese with simultaneous interpretation in the Zoom channel. So Zoom participants, you have to select English option for the next session. And I think Carlos Jaime is already here in the plenary. Okay, fantastic, for a really final close. And then hand over the session to Ricardo Cruz Correia, is going to be the host of the next closing keynotes. And we have here already in the room Professor Fernando Araújo, CEO of Hospital de São João, which is the hospital connected to this medical school. It's an amazing complex. I wish our remote participants could be here. It's really a modern building, a modern facilities, a leading hospital. You have here the view of our auditorium. And also João Figueiredo is already in the room, right, João? João Figueiredo is should to be here any minute, and we will be starting in 6 minutes. So, Carlos, you can take. Yes, Urske, you're saying something?
Oh, Paulo, there was a question. People are really interested in how to get those wonderful videos.
Sorry?
We had a question. People are interested in how to get those videos.
Okay, so that's a good question. Thank you for that. We have a virtual space for this summit, and we hope that in the virtual space, these conversations can proceed. We will be posting selectively the content that we are documenting here in this summit. And also we want that this content be alive. We want that you also comment on, share your perspectives, because we have now more than 450 participants in this virtual summit. So I believe that united by the concern on health data, and it's important that you can share your comments, you share your voices. We are eager to listen to what you think about. This content will be in our space, the videos will be there, and you can keep the conversations alive throughout the year, hopefully until next year. Thanks to our sponsor, Outspace. This space is available for the community as data. Health data is now a public good, and we want the public to be as much involved as possible in these discussions. It's your health, it's your life, and take a stake there, because at least, in our space in European Union, European Commission will be listening to us. The European health data space is there, and they are listening to us. Okay, so golden minute, Miguel, João, and Carlos Jaime for concluding this session. Miguel, golden takeaway.
Well, takeaway, perhaps repeating a little bit myself. So, importance of data. Without data, of good quality data that is actually understood and being actionable data, we cannot progress with all the technologies that offer a lot of promise. But like AI, in the case of what we were discussing in our particular panel was artificial intelligence. But yeah, we also need to take into account to moderate expectations about what role AI may have in the future, and not being a panacea for every single issue, every single problem. But yeah, start with concrete topics, with concrete problems, with very particular issues, and prove the value of those technologies, to then move to a more generic or general AI solutions that could indeed be one of the contributors to tackle the health care provision of the future, along with, for example, wearables.
Okay, João, golden takeaway.
Golden takeaway. I think this one works. Yeah, great. Certainly, just to reinforce, Paulo, your point about open data, bringing stakeholders together and forward these conversations. For me, the golden takeaway has got to be strategic partnerships, because no one has the answer on their own. And I just learned that this morning with Professor Ricardo and also Duarte from Unilabs. We need to come together, focus and leverage each other's expertise. For example, I'm certainly not an expert in data and in everything, and we need the different stakeholders, the private healthcare providers, the academics, the people that niched and expertise in one specific area, and leverage each other's strengths. And that's where the answer will come for us to push these agendas forward, to contributing to society, people, and humanity.
Thank you so much. And Carlos Jaime, last but not least, the golden takeaway for this peer conference.
Yes, thank you for the organization, first of all. Thank you.
My pleasure.
I think we have the same diagnosis about the situation, and we need to have access to data and the right data in real time. My feeling is that at the European level now, we have a global strategy to build something strong, common for Europe, in order to manage in secure way the data in healthcare, but also not in healthcare. And this is the main topic. But what I would like just to highlight is, for sure, we are since long time involved in the really innovative solution, but we forgot sometimes the real life of the medical staff, and we should be focused to go step by step and to create value for medical teams. And if we create value for medical staff, we will have a better healthcare organization. And for sure, currently they are spending too much time in administrative ways. They have no access to the real information to make the right decision. And this is what we should encourage. This is what we should go together to find the right tools to help the medical team to do the life better.
Fantastic. Thank you so much. We couldn't have a round of applause, please, to this panel and to this great peer conference. A round of applause. Thank you so much, dear participants on Zoom. I kindly ask my team, Reggie there,